So my name is Ashley McInnes. I'm the Senior Charge Nurse in the Acute Medical Receiving Unit at Monklands Hospital. We do twice a day board rounds at 11:30 and 2:30. These are multidisciplinary, so it is the nursing staff, medical staff, physiotherapy, occupational therapy, pharmacy, and somebody from the discharge hub, usually social work. So these board rounds are a holistic approach to patient care. So the board rounds allow us to plan the patient's discharge. If they've been discharged from us, the medical staff can give us their plan and we can work through diagnostics, etc., and hopefully, we can get them discharged from us with a robust plan of care and a discharge plan to follow out in the community if they need follow-up, etc. If the patient is going to stay, and need some ongoing medical care, we can plan their discharge date along with the social work team. These plans follow the patients into the back of the hospital and it allows for better flow. Once we've got quite a robust plan, these obviously can change once the patients do move downstream slightly, but it gives us certainly a kind of basis or a forward plan that allows the team further down to work on, which is better for patient flow as we've already got a slight plan in place that we can use. We've also got a planned discharge date that we can work towards, and as I said, social worker there that they know that these dates are estimated. We can start getting things put in place such as packages of care and things so that we can organise so that there's not any delays to get patients back out to their own homes.
Hi there, my name's Grant Reid. I'm one of the IMT3 trainees working in the Acute Medical Receiving Unit at Monklands Hospital. On the AMRU unit, the medical team consisting of consultants and junior doctors review the patients every day. We then, around about lunchtime and also later on in the afternoon, perform a board round with our nursing colleagues and the wider multidisciplinary team. At that point we'll go through each patient in turn, discuss the medical, the nursing and the MDT plan, and identify either whether the patient is fit for home or a suitable ward for them to progress on to. At that point we also attempt to identify an estimated date of discharge. This allows us to try and plan as a team for safe and effective discharge and avoid delayed discharges. It also allows us, when these patients move on to their downstream ward, to to communicate on that estimated date of discharge, which gives some continuity to the clinical team that will be taking over their care.
Hi, my name's Kerry Patterson and I'm the Interim Service Manager for Emergency Medicine and Medical Services here at University Hospital Monklands. My role in operational flow is supporting the teams with any barriers or challenges that they may have for their patients to discharge. I have been working with the teams at the front door and looking at how we enhance our pathways, ambulatory pathways and different pathways to prevent patients from hospital admissions, and also supporting at ward level in terms of standardised board rounds and looking at how we can roll that out across the site. While we already do it, we're looking at how we can maximise the efficiencies in these meetings across multi-agency and making sure that we improve attendances and have the appropriate structure necessary to work through all the processes to ensure that we have a home first approach for our patients. Within improving these structured board round processes, we have also been having a focus on the utilisation of our discharge lounge and our morning discharges from the wards, and really encouraging the teams to think about what that actually means for whole system, for those patients waiting in the emergency department to move into a specialty bed, or those patients in a receiving area that require to come into a specialty bed, or indeed those patients in community or in an ambulance requiring hospital admission.